Hi, my name is Kevon Owen. This is Holly Shockley. She's from Thrive Christian Counseling. Thrive Christian Counseling?
Thrive Christian Counseling.
Thrive Christian Counseling.
Yeah.
It's in the name. And sometimes there's this thing that I don't particularly fully understand, and it's called hormones. Now, when I was back in high school, I would date people, and then things would be going well, and then they would go terribly bad without a lot of warning, and I wouldn't know exactly what was going on. And later on, now that I'm a doctor, I understand that there's this thing called hormones that plays a role in the way that you see the world and the way that you react. And sometimes they try to drive. How do we help people understand the connection between hormones and mental health?
Absolutely. There's a huge connection, and if we act like that they don't play a role, I think we're missing a huge piece of the puzzle. So identifying with a lot of times it's my female clients who are needing to either go to a doctor to have their hormones checked or have some just either holistic care for hormones or medication. And just by them seeking information about their body and what's happening with, cycles of hormones throughout a month or after childbirth or even later in life, that helps to heal such a huge piece of the pie that we're able to look at deficiencies in behaviors and even how we experience things, and we get headway there when if we don't actually go and look at the hormones, then we don't really get a lot of places with it. So
there are three major players in this one. You have estrogen, and we hear estrogen, we blame estrogen on so many things. And there are places where estrogen likes to hang out. So pregnancy, cycles, breastfeeding, those places we want to watch and see kind of what's going on with the role that estrogen is playing. And now the best way to watch this is by talking to a physician and let them actually watch it. But you can see where spikes in emotion would be present. Or there's androgen. Androgen is a lot more passive, but it's kind of the balance. It goes between the two and helps us to stay where we want to be. And then you have testosterone, and everybody has all of them. Yes, I have a healthy level of estrogen and a healthy level of testosterone. And if they're doing what they're supposed to do, then everything kind of balances out. People regularly come in and say, you know what, my libido is gone. There's nothing happening. Maybe your body's doing something, and maybe you should watch that. Is that a bad thing? If a woman's estrogen is off, is that a commentary on the kind of mom she is? Or if a man's testosterone is off, is that a commentary about how they are as a man? No, certainly not. Hormones, they don't go away, and I think that it's important that we remember that they cannot be our driver. And sometimes people tell me that it is what's driving them, and it shouldn't be. If you're aware of the fact that I'm blaming what I'm doing on hormones, there's a response to that, and that's to track it. They draw your blood. It takes a little bit of time. They tell you where you're at, and they'll write a script. If it is hormones. If it's not hormones, then maybe it's my choices. So there's lots of things there. If you want to learn more about hormones and the role that hormones play in your mental health, no, this isn't just for women. It also applies to men. It also applies to adolescents.
Yes.
I've never seen children who it applies to, but I'm sure it's out there. And so track those hormones, see if they're playing a role, because you need to pay attention to the whole self and all the things that are going on. And a good counselor can help you along that path, a good medical doctor as well. So give us a call.